Welcome to Thursday Thought Leaders with Harbinder Narula. India is playing a crucial role in training and exporting nurses to various parts of the world. To discuss this, I have with me Mayank Kumar, who's a prominent figure in India's education and talent mobility sector. He's someone who co-founded UpGrad and a project that was focused on lifelong learning, where they have impacted 10 million learners until now. And he's now co-founded a company called Borderplus, which is right now focusing on nursing talent, training them and exporting them to the globe. Welcome, Mayank, to Thursday Thought Leaders with Harbinder Narula.
Thanks, Harbinder. Thank you for having me today. And very succinctly, you have put it across, but you use a word called prominent figure. I'm nobody prominent. A person who has been in education space for a very long time. So when you are at it for a very long time, you do become prominent, I guess.
Absolutely, absolutely. And Mayank, work speaks for itself. The impact that you have created, the brand presence that you have with UpGrad, I think has built in a lot of credibility. So kudos to the team that you put together that has built, UpGrad to where it is today. And I'm sure Border Plus is also going to follow the same trajectory. So, Mayank, before I get into deeper into what you do, what do you think is the current scenario of the demand of nurses across the globe? Which are the countries that are facing shortage and are looking to import manpower from India?
Yeah. No, I think if I go into See, I think one of the things that we need to realize, and I think what's happening globally is that the entire ecosystem is slowly aging. So what you're seeing is productivity, the reproductivity numbers have dropped significantly. Percentage of population in the 60 plus age category is increasing sort of steadily. So what's happening overall, Harbinder, is that given that rise, the number of people exiting the workforce is much higher than the number of people entering the workforce for most developed economies. So we are sitting at a very unique position, and we never realized this that India's average age is about 28, 30 years old. If you go to the US, UK, it's at 40 years old. Germany is at 47. Japan is at 51. And there are supposedly about maybe 2 billion people who will cross the age of 60 by the time we hit 2030. So the world slowly is aging, and what's happening that because of that, the total requirement for care is increasing, and that's why healthcare is the evergreen sector that we always talk about. That more people are in the healthcare space, and it's bound to sort of increase. But interestingly, the second phenomenon that's happening is that the number of people in the workforce and active workforce is declining. So the number of nurses that developed countries have today is slowly declining because the number of people retiring is more than the number of people entering the workforce. And the sector perhaps does not command the same level of salaries that globally sort of other segments sort of would command. So what is leading to a situation is where these developed economies, Japan, Germany, US, UK, they need to bring in talent from international markets to support the care workers and the care worker ecosystem. And that's the journey that we are seeing, that there's a significant shortage of nurses. The estimates that the WHO projects is about 4 to 5 million shortage of nurses that will happen in the next by 2030. Now that shortage is going to expand and keep on continuing to increase. And that's where countries like India, Philippines, Brazil, Mexico, North Africa, etc., are saying that, look, we have young population, can we train them and can we supply these talent pool to international markets? So that's the broader macro thesis, Arvind, that's playing. And that's the thesis that Border Plus had taken up to focus on capturing the market at this point of time.
So, Mayank, this is very interesting. I can understand that the world is experiencing an aging population, while we still in India have a younger population. But despite that, I mean, in those countries that we are supplying nurses to, is there a reason why these people there are not taking up this profession, or is it just because it's the demand is much higher than the supply?
Yeah.
Because the number of people joining the workforce is also proportionate to the population that exists there.
Yeah. No, so I think there's definitely the first point is very clear that the demand is absolutely exceeding the pace at which supply is coming in. And actually, the supply is declining, Arvinder. So what's happening is the number of people or the percentage of people in the 60 age plus category, for example, that's a metric for us where we can take as a metric for increasing care. So as the percentage of population over 60 is increasing, the number of people entering the workforce is declining. So the nurse to patient ratio or the patient to nurse ratio is slowly getting much more skewed towards patients, and there are more sort of patients coming up in the space. Second phenomenon that's also happening is while let's say the people who are coming out of college ecosystem in some of these developed market is reducing. So today, very interestingly, and this is something that we don't get to talk about, the number of people graduating from the school system in most developed economies is declining year on year. And therefore, the number of people entering the college system is declining year on year. And therefore, the number of people graduating out of the college system is declining year on year in US, UK, Canada, Australia, so on and so forth. So therefore, the workforce is also declining. While the percentage of people above 60 plus is increasing, the workforce is declining, and therefore that is creating that gap and that delta, which is becoming more and more acute, specifically in nursing, because what you need to also realize, Harbinder, is that you have been in the healthcare space, so you have seen it much closely that um, as the society ages, you just don't need nurses, you also need caregivers like old age homes, so on and so forth. Now, old age home as a concept is perhaps not, does not attract a lot of talent pool coming into that particular space. And that's where even the, while the number of people are declining, the percentage of people choosing nursing as a profession is also reducing. So both the factors is creating this acute demand. Germany as a single country has stated that they will need about 500,000 plus nurses, 500,000 nurses by 2030. Japan is another interesting case I'll give you. Last year, about 45,000 people died alone at their house, and 4,500 Harbinder were found 1 month after they passed away. So that's the situation that we are talking about, that there's not that many people to take care of them at their homes. And the government has realized this as an issue, and therefore they're looking at hiring and getting talent from global markets to solve for the demand supply gap.
And Mayank, what we are experiencing today is that in a lot of these developed countries, there's a lot of dissonance among the local population uh, with respect to government allowing immigrants to come in and taking up jobs. Uh,
Correct.
More specifically, when people are when the countries are able to hire people at much lower cost.
Yeah,
Uh, Local populations sometimes do not understand the dynamics of the need for the sector when
yeah,
they are responding to that, why are you getting people from overseas? Just they're taking away our jobs. And we've seen that in the US and other countries. Is this something that you have also experienced, or the people who have moved from here experienced in the nursing sector, or is this sector a little different
yeah.
from the usual IT, etc.?
No, very fair question. So, I usually break down immigration and global mobility in two parts. I mean, so there is the legal route and there is the illegal route. There is the person who goes with all the sort of documentation, etc. There's a donkey route, which is the famous movie that a lot of us would have seen. So there's a fair bit of concern that you're seeing from, there's a growing right wing sort of government across the world, and that's a phenomenon that we are seeing across most economies right now. And there, what the conversation that's happening is that, look, we do not want people coming in illegally to the country, and we do not want, as I think you alluded to that point, that I do not want cheap labor. uh, and therefore nursing from that context is very different, because you cannot become a nurse if you come via any illegal route, because you need to show your documents. Unless you become this thing, it's a more regulated space, so to say. Number two, nursing is a space where it's been, over a period of time, you have seen international nurses being an integral part of most nursing societies globally. So if you go to the Gulf, you will see a lot of folks coming from Philippines or India and Kerala and so on and so forth. If you go to the US, you will find enough nurses. NHS is full of nurses coming from India. So there's an acceptability and acceptance of international nurses, unlike in other sectors. For example, and you're hearing a lot of conversations about how are we seeing more talent coming into sectors like constructions, manufacturing. So there are certain spaces where they see it's more illegal migration happening, and that's the place where people have become much more cautious. And it has happened a lot because of Europe opening up doors to, let's say, illegal migrants or asylum seekers. So when the asylum seekers are coming in, they're not coming in because of skills. They're coming in because they were pushed out of their own home country into a new country. But if there's somebody coming with all the legal routes and the legal sort of process and passage, the acceptability is much better. And Indian nurses, Harbinder, for that context, are very highly respected across the world. And they are one of the few people that everybody says, okay, if I want everything else, for the care workers, give me care workers, because they're much more empathetic towards how we do deal with things right now. So it's a different story altogether on the nursing migration front.
Yeah, I couldn't agree more with you, specifically, not just nurses, but anybody who's into healthcare profession coming from India has been able to create a mark for themselves, both in terms of empathy as well as the skill that
Yeah.
they're able to offer. So
And
that's
touch upon skill one very quickly, because you mentioned the word skill. So why do Indian nurses get accepted? And that's an important question that a lot of people ask. India is one of the few countries that has a very strong BSc nursing curriculum.
Mhm.
Most other countries, nursing is taught as a vocational training program. So it's a more apprenticeship based, a diploma based, or a vocational based sort of product. India has a degree program, and that creates a very different positioning for Indian nurses. Because if you have done BSc nursing, you have gone over and beyond what most countries offer in their internal curriculum itself. So Indian nurses never get rejected because of skills. The reason for rejection of Indian nurses is language and culture. And those two things are the bigger thing that currently we need to work and solve for.
And Mayank, when we look at healthcare sector, and specifically when you're looking at medical tourism, we are always telling them that, even when we are able to charge a premium to our to overseas patients, we still are able to offer services much lower than what it costs across the world. Similarly, when the nurses from India who are going out, even though they are affordable by these countries, but from the Indian standards, as the salaries that they are offered overseas is much higher than what they can think of getting in India. Now, this is creating a very big challenge for our country. Our hospitals are not able to retain these nurses, and if we were to increase the salaries, is going to create a challenge in terms of the cost of healthcare. Is there a reason apart from better salary because of which nurses are choosing or grabbing opportunities overseas? Is there beyond money that they are looking to go out?
No, it's a very strong, good question that you have framed, because while money is an important factor, and you rightly said that, look, the money delta is significant. If in India, a nurse will start at 15, 20, 30,000. If they're working in a large hospital chain, maybe 40,000 rupees a month after tax, whatever that they get at the end of the day. And if you land up in Germany or the UK, you earn about 2.5 to 3.5 lakh rupees a month. You can still save after the cost of living 50,000 to a lakh every month to send back home. So while money is a very integral part of why people go, but there are many other factors also that sort of is there. But before I get to the other factor, I do want to mention, Arvind, that India has an opportunity today to actually increase the production and the capacity of the nursing supply that we have. We are underserved in India, but we have a lot much more population available that can take up nursing as a profession. We still glorify a lawyer or an engineer or a doctor, but nurses is something that is going to be an evergreen profession for a very, very long period of time. And that's something that I feel that the government's last budget had a strong push on medical infrastructure and medical teaching growth and more nursing colleges coming up. And that should happen in India, because we have an opportunity, as you said, in medical tourism, you can be healed in India, you can be healed by Indians, and you can be healed in by Indians in your in your source country also. But for me, I think the reason why nurses are looking abroad is, one, you rightly said, is salary, and there's a 10 to 20x delta in the salary structure between India and internationally. If you are and a nurse, potentially, if they're living abroad, they can send anywhere between about 8 lakh to 12 lakh rupees a year. That's the kind of remittance that happens. But beyond the money, they feel that the professional respect and the professional value of a nurse in the society is much more when you go to, let's say, a UK or a German or a European market compared to what it is in India. The training infrastructure is much better. Uh, for a lot of nurses, when they look at going abroad, they also see, is it just salary, or do I get family visa? Do I get PR? Do I get opportunity to settle down? How is the housing? What happens in the long-term migration, immigration opportunities for us an individual? And the last one is they feel that for many people, when they're going abroad, they want to see, okay, can my family also come along? And what is the status going to be for my family as well? So I think global migration is seen by some people as a short-term 5-10 year period to earn enough money and come back and settle in India. But for many people, it's a long-term shift. Uh, India today, Harbinder, has about 35 million Indians living abroad outside India. These 35 million Indians send close to about $125 billion worth of remittance into India. India's oil import bill, we import oil because we don't have enough oil, is about $150 billion. So $125 billion, in some way, the remittance money gives the forex exchange for us to pay for the oil import that's happening for the Indian market. So I think more Indians going abroad supports the economy in a very different sense. But having said that, we do need to expand the capacity of nursing infrastructure in India to support the requirement that the country has and then the world has as well.
And Mayank, another thing when it comes to blue collars workers, nurses, support staff, uh, the challenge that we have seen or the stories that we have heard, that apart from countries like Germany and other countries in the Europe, there are countries in the in the Middle East.
Yeah.
They typically there are stories about uh, Indian workers not being treated properly, their passports being taken away, and the staff feels stuck there. And so, apart from creating training enough nurses and then exporting them, is there something that you would do to ensure the safety and protect these nurses from any kind of situations that could be adverse situations that we've seen in the countries?
Yeah. No, I think if you look at the ecosystem, Indian nursing going abroad is a very old phenomenon. It's not nothing new that Borderplus is trying to create because they've been going abroad, as you said, to Middle East, Gulf countries, and so on and so forth. Um, but this industry, Arvinder, is fraught with lot of small mom and pop operators who will come and say, "Okay, आपको बाहर जाना है, pay me this much amount of money, and I will take you abroad." They will take the money and then they will disappear. They will say, okay, now you want to go abroad, pay me this much amount of money and you will definitely get a job abroad. They will take the money and then they will say, no, 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 but you need to now apply for a language examination. You need to prepare for that. So pay me something extra and I will train you there. So there's a lot of sort of opaqueness that exists pre them going outside the country. And that's the one place where a lot of sort of cheating, a lot of um, um, fake and corrupt practices are there. But to your point, even after landing, there are enough corrupt and irregular practices that happens, whether they will take your passport, they will sort of say, okay, now you're coming here, but you have to do 2 year bond. But if you go through the International Labor Organization rules, it clearly sets a framework for ethical recruitment for international talent mobility. And I think as Border Plus, that's something that we adhere to very closely. So for us, when we are working, we work with only licensed and vetted hospitals and nursing homes. We don't try to work with a third party broker because we have entities in both parts to sort of ensure that we are covering the entire spectrum end to end. We focus on a lot of pre-departure orientation to tell our nurses about their rights, what are the red flags, what is the embassy contact where you're landing up at, and we provide a buddy here as well as in the destination market for grievance redressal. I was chatting with somebody else 2 days back. I mean, I do these regular conversations with nurses coming on board to join our program. They said, sir, if you ask us to give your passport, how much time do I have to give and submit the passport to you so you can keep it with yourself? I said, look, I can't ask for your passport at all. I'm not authorized to ask for the passport, but that point that you mentioned is a thought process that everybody has, that if you are going there, you are going there as a I mean, I'm not called prisoner, but a bonded labor.
Yeah, yeah,
And that is something that we need to change. And I think government is also coming, Harbinder, now with very clear framework to
mm,
ensure safe and transparent migration. And I think newer operators such as ours and Borderplus, etc., are now trying to follow and adhere to that because this system requires more legit and trusted partners to come on board because then only we can build something at scale and meaningful.
got it. And Mayank, apart from just sending, exporting manpower or nurses to other countries, you're also involved in training them. So, what are the kind of skills other than the mandatory training in terms of nursing are you offering to these nurses so that they become attractive healthcare providers in the countries, in developed countries? I
Yeah,
mean, because apart from just being able to serve the patient, the
right.
fitment, like you said, the culture, etc., are you doing something around that?
Yeah, no, I think sometimes people say that for exporting talent and for sending talent, I said we are not here to export talent. We are not here to send talent. We are there to receive the talent ethically in the destination country. So we always come with that mindset, Arvinder, that we are there to support and bring the talent into a country rather than send the talent abroad. So we receive rather than we send. But see, on the clinical care, I think we spoke about this earlier that the BSc nursing curriculum is phenomenal. I think UGC and the Nursing Council have done a phenomenal job in creating the structure of BSc nursing. So most countries do not ask for any other clinical skills beyond what you have as BSc nursing. Yes, you may have to do a little bit of NCLEX in the US or maybe an OET in the UK, etc. But for Border Plus, we believe that we just don't want you to send there because there's a job opportunity. We want you to succeed there. So we focus on a couple of things beyond just core clinical skilling. I think the first one for us is pure play language proficiency. And every country has a language proficiency requirement that you need to cover B2 in Germany, and in the UK also has now released their IELTS score, so on and so forth. So language proficiency and language fluency is the number one thing that we focus on. The second critical thing that we focus on is the entire aspect of cultural sensitivity besides empathy and sort of dealing with things. So I'll give you an example. In Germany, there are multiple. Germans are very process driven and they want to follow process. So they love people who follow processes. In India, we are not used to following too much of processes. In German, when they say yes, it means yes. In India, when you say yes, it could mean yes. In some cases, it could be maybe. In some cases, it is no, but we don't know how to say no. So training these girls when before they're going abroad that look, their cultural ecosystem that you need to be very direct, you need to be blunt. You cannot ghumao everybody and sort of take them round in circles, etc. So we focus a lot on cultural competency, and we feel that there are four aspects of cultural nuance that every nurse should understand. Uh, the first one is clarity, that you need to be clear in your communication. Second is assertiveness, that when you're speaking, a lot of places they don't have doctors. So some nursing homes are within Europe, they get doctors once in a week, or doctors are on call, they don't come regularly, so that nurse has to be very very sort of assertive. They need to manage stress because a lot of time the stressful situation comes, and how do you deal on a from a cultural perspective to stress. And then the last one is empathy. So these four elements is outside of language we focus on to give them on a cultural basis. We also give them training on digital competency, that how should they look at using EHR platforms, tools, productivity tools to enhance their sort of overall adaptability when they land up there. We have built AI solutions which will simulate hospital scenarios. So I can put you as a nurse into hospital in Germany today, Harbinder, where you can have a conversation as a nurse, and I will tell you how German you are, or how English you are, or how Italian you are as a nurse, by mapping them to the cultural context of that particular country. So I think leveraging technology, we are able to sort of go beyond just skill training. So language, culture, digital adaptation, and then AI-based training is the kind of holistic framework that we follow to train our nurses to go abroad.
And what kind of salaries do they typically get? I mean, you spoke about Germany being 2.5 to 3 lakh rupees a month.
Yeah.
But what's the average salary that a nurse, a well-trained nurse with about 3 to 4 years of experience can expect?
I'll do a back and forth with you. So let me ask you the first question. What do you think a nurse earns in India?
My guess is that in a nursing home to a very small hospital, it would be around 15 to 20,000 rupees,
Uh,
and in a large hospital which is following the processes and the minimum salary standards and respecting the experience and looking at retaining them could be around 40 to 50 to 60,000 rupees,
Correct.
70,000 rupees at max.
Correct. So yeah, so I think if we let's take that as a benchmark. So about on average, we let's put it as about 20-25,000 to 2.5 lakh rupees or 3 lakh rupees what a nurse earns. So let's say 3 lakh rupees.
Mhm.
UK is about 30 to 50 lakh rupees a year, uh,
Yep.
annualized basis. So three goes to 30 to 50. US is at about 60 lakhs to about 1 crore a year, uh,
Wow.
roughly. Germany is about 28 to 35 lakhs, so about 30 odd lakh in Germany also. Gulf countries at about 30 to 40 lakhs, but Gulf countries has got no taxes. So that's an advantage, and sometimes housing is also given. So for a lot of nurses, the jump is in terms of salary is about 10 to 20 times than what they're earning in India. So you said 15,000, 20,000 rupees to 2.5, 3.5 lakh rupees. It's a 15, 20 time jump in the salaries. But um, uh, but we say, okay, now, but Mayank, this is all good, but these are all dollar figures here. You're just converting them into rupees and you're giving me the numbers. But the interesting thing there is that even after taking the cost of living and the PPP adjusted sort of parameters, uh, the nurses still save about 50,000 to 1 lakh rupees in a Germany or in the UK every month. Compare that to minus 5,000 or minus 2,000 rupees that the nurse will save in India for all the expenses that they have. So the saving is a significant amount, and that's why I had a first batch, Harbinder, and 100% of them got placed. 100% of them got placed. And I don't know about you, but I'm a third generation college graduate in my family. Uh, my dad was a college graduate, mother was a college graduate. My grandparents, at least my grandparents, the grandfathers were all college graduates. These girls come from a place where they are the first generation going into college. And when they get this 30 lakh or 40 lakh rupees salary, and then they see that, look, I can save about a lakh a month, it changes their lives. It changes their family lives, which is, let's say they will have a family of 3 or 4 people. It changes the life of the parents and the siblings. So one life change for me here is equal to about 10 to 15 life changes in the society. And that's the beauty of what this transition and global mobility can provide for some of these individuals who are looking at an international career opportunity.
Mayank, let me bring out the another aspect of the impact that you're creating. Let me move on to what is the impact that you could create for India. Because my understanding is that India is a high quality, low cost healthcare destination. You know, but if the trend of this brain drain continues, and we've been able to reverse that for the doctors, but what I've spoken with the hospital owners of
Hmm.
very, very large hospitals, one of the biggest challenge that they're facing in their hospital is the nursing, because they are losing these nurses to the global, the need that is there. If they were to increase the salaries of the staff in India, and I'm not talking of a small hospital which pays 15,000. I'm talking about decent hospital which pays market value in India. We are going to lose our competency in terms of the low cost or affordable, good quality healthcare. Is there something that you at Border Plus is thinking of how you could serve the Indian industry uh, and by being fair to the nursing staff as well as to the healthcare industry and create a kind of a win-win situation for the Indian healthcare industry?
No, it's a very valid tension, if I can use the word tension for what we are doing. And it is not an easy answer for me to give. Like I can't give you a very clear answer that look, it's no, it's okay, fine, everything is good. It's economics 101, capitalism will win, etc., etc., etc. But I have a three-pointed approach, and the way I look at it, I don't have a solution, but what at least I look at it. I think one way of looking at it is that, look, when Indian nurses go abroad, it's not just a brain drain, because I think as growing up, I used to have this um, debate of brain drain or brain loss, etc. And today, all the CEOs are from Indian background. India is benefiting because of that. So I personally feel that one bit is, yes, we lose talent, but the other bit is that it actually creates a significant amount of remittance coming to the country and brings in a different kind of expertise and global exposure to the talent that India has. The world needs it. They take it either from India or they take it from Philippines, they take it from Brazil. But if India can take on this share of that global demand, it is beneficial for Indian society in general, because a lot of these girls will find much better opportunities and it will lead to more remittance. And I told you the number of 125 billion, 125 billion of oil import, export, etc., which covers both of the aspects right now. So I think remittance is one angle that I look at, that it is not just people moving out, but people actually learning and then returning back to the society in different ways. The second way I feel that as Borderplus, our job is not just to ensure that people are getting ready and getting abroad. I also need to work with the college ecosystem in India to create more capacity building out here. I would love to sponsor more seats at various colleges that can be either blocked for international migration, which means that more seats can be opened up for domestic recruitment, etc. And those are the work that we need to do as one of the participant to actually create more nursing homes. Multiple university, Harbinder, you'll be shocked to know most of them do not have a nursing college under their own umbrella, because it's not seen as a more lucrative, quote unquote, seats in the university. But today, 5 million shortage as per WHO. If we have to solve, India can take 30% of that. And that's the opportunity that is sitting in front of us. And for that, we have hardly 100,000 graduates coming out every year. We need to get to about 400 to half a million nurses coming out every year to support what we need in India and to what we can supply in international markets. So I think capacity building is the second sort of pillar that I look at more sort of meaningfully. But the third one that I feel more interestingly will evolve as we go along is that some of these jobs will actually end up becoming more circular or more guest-based visa. So you will go to an international destination for a 5-year visa or a 7-year visa. You work and then you come back to the country and you get integrated in the society in India itself. So you go abroad, you learn, you pick up skills, you earn enough money as savings, and you come back to India and you can apply the same learnings into the Indian ecosystem. And I think government is thinking of this concept of guest visa, which will mean that Indian talent goes abroad, settle for some time, earns enough money, comes back, and there's a circular flow that happens in the overall scheme of things. So I think these are three pillars in which I look at. These are very policy level decision. I think as an individual entity, I'm not able to. Maybe I can impact to a some marginal extent, but to impact and create at a large extent, we need all the ecosystem of private partnership, public ecosystem, government, and the Ministry of External Affairs coming in together to create an ecosystem which is more circular in nature, with more capacity in India, and with remittance coming into the Indian ecosystem also.
Well, that sounds like a win-win situation for everyone, both for the international market as well as the domestic market. But Mayank, do you also get the requirements from overseas stating, like, for example, when they're looking at management graduates or engineering, they said we need people from IIT. When they're looking for management graduates, they're talking about ISB or IIMs. In nursing, do you get requirements saying that, we want people who've been trained at this particular center or people who worked at these hospitals?
No, so I think right now the requirements are, give me a nurse. That's it.
That's the kind of demand that is there.
Give me a nurse who can speak German, who can speak English, who can speak or who understand the cultural context, but give me somebody who can at least articulate. And that's the requirement. So no sort of background, no stamping, no caste certificate that, look, if you're from IIT, you are better. If you're from IIMs, you are better, etc. So I think all those are not there. What they require is a nurse who has done BSc nursing and at least has a good spoken understanding of the language. Now, the challenge that we see in the space is that the language understanding is what is fundamentally broken right now. And you have to clear, let's say, TELC examination. That's one of the examination that you have to create, and then you pass the examination. If you score above a certain marks, you get a B2 certification, and then you can apply for the visa. As Indians, we are so good to crack an examination that I have seen multiple mark sheets of B2 examination. People have got 61 or 62 because 60 is the passing marks. So we don't go to 70, 80, 90, but 60, 61 passing marks, we are happy, but we don't know how to speak in real time context. So when Indian talent lands up in international markets, language is a bit broken, and therefore they can't have a meaningful conversation. And that creates loneliness for the individuals who are there in the international markets over.
But Mayank, I think, it is imperative. Language and command over language is extremely, extremely important, not just for the basic communication and addressing the loneliness factor. Because what I understand of healthcare is that the nurse is doing a very important role of interpretation of what the doctor is wanting to do. And that becomes a very important aspect in terms of being a conduit between the doctor and the patient and the caregiver. So
Correct.
I think communication is something that is paramount.
And you have front in line. So there are two skills that I break down, Arvind, very quickly, just for your reference, that there are certain jobs like healthcare,
Mhm.
uh, retail, um, and I would even add hospitality.
Yep,
That empathy driven skills
correct.
that you do need to have conversation. You can't just sit behind the laptop and send a few
Yeah,
codes across. So I break down the market into empathy skills and hard skills. Trucking, you don't need to talk. I mean, you don't need to talk, but you don't need to talk to the same extent.
right.
Construction, you don't need to talk too much. Coders, you don't need B2 level of skills, but these four skill areas, retail, hospitality, education, and teaching, sorry, education and education and kindergarten teachers, these are the places where you need that empathy driven skills, which is more important than any other places right now.
I agree with you. And Mayank, what I understand from the conversation that we are having, that the demand is so much that people are just looking at if there's a nurse who's skilled, who's been trained, and can have a good conversation, just send them over, right? Uh, how do you and India is well poised to be the global provider of this particular talent. How do you think that the government, you spoke about 360-degree or a circle economy, uh, kind of an opportunity. How can the government, as well as training institutions, as well as ethical recruiters, align themselves to create a kind of a quality platform that serves the need that is there, is able to help the nurse find the right place for her profession or his profession, as well as the private sector, which is involved as a platform. They're all aligned to create a, a, a fair win-win for the three people involved in the process.
Yeah, I think all three have to come together, as you said. I mean, do need government to play a very critical role. Finishing schools have to play their equally critical role. They just can't be fly-by-night operators. And then recruiters need to follow the ethical sort of playbook. Now, this question answer, Harbinder, I can go on for 5 days with you on this conversation because I'm deeply passionate about how structurally we can change it. But on a very simplistic way, what I think government's role should be, because government will play a very very important role as part of getting this entire ecosystem up in space ready. The role that the government can play is how do they create a, I'll give a very interesting example of UPI, right? UPI is a government backbone infrastructure. On top of UPI, a phone pay can come, a Razor Pay can come, or whatever, a Google Pay can come, a Paytm can come and build on top of that. And you can then create an infrastructure layer on top, platforms and application on top of that. Government should be a strong platform layer which has a lot of data points to suggest which recruiter is ethical, which candidate is true, which recruiter has got the right sort of background credential, which candidates mark sheets and job sheets are sort of well covered in the process. So government becomes that conduit which can connect the two part of the marketplace. And I don't want government to play the role of a provider, because that's not what their role should be. But they become the trusted layer, like a UPI, like what NPCI has done with payments, in the context of global migration. The training institutes, such as finishing schools, such as Borderplus and so on and so forth, they need to constantly work with the recruiters on the other side and the colleges in the country to ensure that the gaps are getting bridged meaningfully, whether they get integrated into the third or fourth year of the curriculum, or whether they sort of create a playbook where curricula is getting changed regularly. I gave you an example of AI-based modulation approach. How can you make the nurse in India sitting in, I don't know, Bhubaneswar, experienced a German nursing home? I can't create so many infrastructure, but with using AI, I can create them the soft infrastructure for them to feel how it feels like when they are in nursing institution. So constant innovation is definitely needed in the context of institution and finishing school to make that happen. On the recruitment front, I think a lot more work needs to be done, because there's a lot of opaqueness that happens there. The recruiters need to be very open about the fact that, will you charge the nurses or will you not charge the nurses? Will you return the money? Will you not return the money? I think that opaqueness will get through done if the recruiters plug into the government infrastructure. And if some of these things do not happen, the infrastructure says this recruiter is not ethically aligned. And that information is good enough to create a seamless sort of play where the candidates will trust the recruiter will trust the candidate, and that platform does the job of what an NPCI does in the current context of UPI right now.
And I would assume, Mayank, that that is your ask from the government as well.
Yeah, no, no, I think that's a very simple ask. I don't want any subsidy. We don't want any benefits. We don't want doling out of capital, but just create an ethical framework which all entities need to follow, because then it's a very clear level playing ground. Because you cannot have a condition, Harbinder, which is, as an ethical recruiter, I cannot charge the candidate, right? But there is somebody else who's not following the ethical standard but charging the candidates. So if you have these two entities, one has got a more economic gain coming from charging the candidate, the other cannot charge the candidate because they're following the ethical norms, then the person who's charging the candidates is going to have more surplus to build something meaningful. And that's the bit that I feel, if you create a level playing field, that's the kind of work that will definitely help the larger ecosystem to thrive and develop.
And Mayank, at what stage of business is Border Plus at?
Uh, we will always be in stage zero. So we will never be in any
How
other.
many people, how many nurses have you already
So we are
placed
training close to.
overseas? And how big is your team now?
No, no, we are a very young team right now. Arvinder, we just started about 6 months back. We are currently training close to about 200 nurses, 250 nurses. About 200 of them are in India, and about 50 are in Philippines and in Brazil. So we have taken up two other geographies to sort of expand into. We have a large teaching team, but the cumulative staff strength for us is about 35 odd people uh, who are working internally. But we work with multiple teachers, multiple faculty members. Our approach is to give a 360-degree place for any individual coming to us. If they want end-to-end service, Borderplus is the right place for them to come on board and sort of build it across. Just for your reference, Harvinder, we acquired a company in Germany, a GmbH, an Onya Care GmbH, which is a recruitment entity in Germany. So while we do finishing school here, the German entity does the recruitment processes for us over.
So they are the license to import people.
Yeah.
Awesome. And Mayank, I'm going to ask you this one question specifically for my LinkedIn uh, podcast.
Sure.
And I'm very keen to understand that personally as well. And it is that, what are the learnings that you've had from building UpGrad that you will be or you could be using or you will use uh, in building Border Plus now?
Oh, that's a tough one. That's out of curriculum question for me. No, but for me, I think uh, no, there's no shortage of learning that I've had from UpGrad to sort of doing what I'm doing at Border Plus. I think the biggest learning for me is these are not races, these are marathons. So you have to be at it, and you have to be at it as a problem. And we're starting with UpGrad. People said that, look, this will not work out because who pays for online program? Why will anybody pay for online program? But we stuck with it. We never left the field. We never made the prices zero. So I think one of the things my son asked me, and this is I learned because I love tennis. I think this was a quote that Roger Federer gave, and it stuck with me for with me for a long time. Um, it's very difficult to beat somebody who always shows up. So you have to show up no matter whatever happens to you. If you're feeling down and out, you show up for practice. If you feel that yesterday was a very bad day, you show up the next day. And I think at Border Plus also, it's a tough problem to crack. It's not an easy problem. We are trying to do finishing school, recruitment, a migration economy. It's full of fraught with sort of corrupt players. And here comes Border Plus, who wants to solve everything in a very fair and legal way. It is going to be a tough journey, but we have to be at it. And I think that's one thing that has always stayed with me for a very long. I mean, for everything that I do, I think there's no substitute to hard work. And just being at it is half the journey won in the process. And I think the second biggest, I think, takeaway for me is I don't know. I mean, I think one of the things that I realize in education, Arvinder, is that it's not a I'm not trying to solve for, and again, no sort of offense to any other sector, but I'm not trying to get somebody food in a 10-minute time. I'm not trying to get you a cab. I'm in a sector which has got massive impact. And it's an impact that is not just at an individual level, but at an entire society level. So when it comes to that impact, you have to be very serious and you can't be frivolous. So my second thing has always been that, look, if you're doing something in impact, you like in healthcare, you can't go to the next day in operation and say, look, yesterday I was a little tipsy, but today I'm going to operate on you. So I think being serious in a space along with being working hard are the two things that has helped me. And I do feel that in this impact sector, you do need to be very serious about how you're approaching the problem still.
So, Mayank, this has been a very beautiful conversation. I mean, the learnings that you've shared, and your kind of being able to relate to the quote by uh, Federer, imbibing in your life is actually very, very useful. But, there were a couple of things that I have taken away as an understanding of this particular conversation. One is that, globally, I was not aware that the number of people exiting the workforce is more than the people entering the workforce. Second is you spoke about the Indian population being younger, which is a great opportunity for us to provide workforce for the world because we have enough workforce and for which we may not have enough jobs in India, but we may be able to serve them by giving them jobs in the countries where there is a genuine need for them. Uh, we have the opportunity to produce a lot of nurses. And what you also spoke of is that nursing is an evergreen sector. It's not something that is going to go out of fashion or there's going to be a challenge in terms of need. And government is also focused on this, and probably that is the reason that it was brought up in the last budget,
Yeah,
where there was a very clear understanding that we need to create more institutes that can produce nurses.
correct.
Uh, and something that I also learned through this conversation is that it's not about money. It's about creating the family opportunity uh, of settling them, raising their lifestyle, raising their standards, and also create a, a profession in a manner that they, apart from money, can earn a lot of respect.
Yeah,
Because this is something which I've also felt when I've spoken to nurses or chief nursing officers that things are changing today. But in the past, we've seen that nurses have not been really respected at work by the doctors. things are changing now because we need their support at the hospital. We don't find that easy, and most powerful thing that what you spoke of is that, when you are operating at Border Plus, your role is of receiving a talent rather than sending the talent. So
Yeah,
you're looking at training the people in a manner that you will be pleasantly receiving and putting them to use in a country which respects them, needs them, and that is the impact that you can create for nurses, specifically when they're coming from India.
yeah.
Mayank, this has been a beautiful conversation. Thank you so much for taking our time to speak with us at BW Healthcare.
No, thanks, Harvinder. Thank you very much for your time again.
Mayank, lovely conversation. I'd love to remain connected with you. Is it okay
Absolutely.
if I were to take your number?
Yeah,
And
yeah.
yeah,
Yeah, it's 9819
9819
617154.
6171
54.
54. I'll WhatsApp you from my number,
Yeah,
and I'll be in touch with you and probably have you over as participating in one of our events.
sure.
Be a speaker, share your journey, your learnings with us,
Sure.
right?
No, no, I'll
Okay,
definitely do that. I'd love to do that. Sure.
awesome.
Lovely talking to you. Thanks, Harvinder. Thank you
Lovely
very
speaking. Take care. Bye. Bye.
much. Bye. Bye.